There's a fundamental change occurring in the healthcare space, and it's primarily driven by the cost pressures that are on our healthcare system. The simple fact of the matter is that we cannot continue the way we have been going with costs increasing in double-digit percentages every year. It's going to bankrupt the country, it's bankrupting many companies, there are too many people that don't have health care today. In Diagnosis One, over the last 6-7 years as a company and almost a decade and a half as individuals, we've been focusing on improving the quality of care. Over that time period, we have developed what's probably the world's largest database of evidence-based knowledge and put it into a system that has been architected to deliver that knowledge to multiple stakeholders. So our core philosophy is that knowledge, to be useful, needs to be maintained in a centralized, coherent, self-consistent body, but the delivery of that knowledge has to be highly distributed. So each set of stakeholders, physicians, nurses, patients, their family members, whoever is involved in a patient's care can get the information they need in a timely manner and only get the information that they need. So they're not bombarded by stuff that's not of interest to them. They have the ability to reach into these systems and say, I want this information, but I don't need this information. I already know this is not relevant to me, this is not relevant to my patient. So alert me when these sorts of things happen, but don't bother me when other things happen. That's the space that Diagnosis One occupies. We are sort of this single entity that can impact multiple clinical systems that are facing care providers, facing patients, and provide to each one the information that they need at that point in time, taking medical data and converting it into actionable information and making sure it gets to the right stakeholder at the right point in time. We are one of the few companies or entities in this that has a very large body of content and knowledge and a very, very robust state-of-the-art system to manage that content and to deliver it as it's needed when it's needed. That capability allows our customers a number of advantages. One of the big ones being that by deploying us through one deployment, one integration, one state-of-the-art relationship, you get the capabilities you probably would need to go to 3 or 4 different vendors for otherwise. So by using Diagnosis One, they can get real-time decision support, they can get care gap alerts, they can do patient surveillance, they can do public health reporting, they can do quality reporting, analytics, patient education. To do it otherwise, you would probably need at least 4 different companies that you'd bring in, 4 different relationships, 4 different technical integrations that you would have to manage. So that gives our customers a very, very robust capability through one relationship and helps lower their cost of ownership.